Hello, I'm Janet Wright. With the sweeping changes to the healthcare system, today's cardiology practices are facing a daunting set of challenges. Practices have to prepare for a new compensation model that's based on performance and integrate new information technologies within their workflow, all the while maintaining the highest quality patient care. Through PINNACLE, we at the American College of Cardiology are developing tools, solutions, and an active community designed to help practices excel into this new healthcare future. It's a future that recognizes the good work that you do and rewards the outcomes that you and your patients achieve together. I had the unique opportunity to visit some colleagues at Fort Wayne Cardiology, a practice that has made PINNACLE a key part of its operational DNA. At Fort Wayne, PINNACLE is the system that puts the patient, the physician, and the entire medical team all on the same script.
Good morning, Fort Wayne Cardiology. This is Shelley.
As Dr. Patrick Daly guided me through the Fort Wayne Cardiology facility, he and his team showed me how their PINNACLE-based system supports every aspect of patient care.
Right. When you consider what PINNACLE is doing is
the flow of information that may begin at the hospital continues as the patient registers.
There you go. Thank you.
It starts with the front reception desk and entering demographics, insurance information.
Okay, now I check you in with Dr. Daly and the staff. You may take
It also starts in medical records when we are flowing laboratories into the EMR, and all of that pulls automatically and populates PINNACLE.
Essentially, the communication starts with the medical assistant who checks the patient in, because she usually checks to see when their last labs were and if they're still pending. Also, she lets me know what refills are needed.
She's going to have them done today after her
Wonderful.
appointment, so.
Wonderful. Does she need any refills?
Nope.
Because everything is auto-populated into the computer, so I know exactly when the last echocardiogram was done, when the last lipids were done, so I can inform the cardiologist, kind of heads up, this is what we need to make sure we order. PINNACLE kind of puts it all together so we are all on the same page, from the front desk all the way to the cardiologist.
Ruth, hi, good to see you. Just a routine.
Time in the exam room with a patient is precious and limited. PINNACLE's organized framework frees up doctors and nurses for listening, learning, and teaching.
There's no other way to get the patient on your team other than to listen and demonstrate that you've heard them. And then the PINNACLE is saying, yeah, you've done all the right things as far as our guidelines. And so we're freer to have a conversation.
It's worked out really well.
Yeah, good.
This is Judy for Wayne Cardiology.
Every aspect of PINNACLE is optimized for speed and efficiency without sacrificing completeness or accuracy.
To show you how quick it is, there's absolutely no time or nuisance barrier, because
PINNACLE is designed to be intuitive and reflects a workflow that's created and refined by the professionals themselves.
We use PINNACLE Registry as a clinical decision support tool. PINNACLE's recommendations gives me the things that I need to do. If they're all done, I just hit submit. It's done. Our goal is to get to the least number of clicks with all the guidelines met. And then everything else, he's on all the right meds. And so.
Hi there, Mr. Chavez. How are you? Okay. This is a list of your medication.
PINNACLE also plays a role in that last and crucial stage of a patient's visit, reviewing the plan of care.
Is there anything else I can get for you today? Our physicians always have taught us to have like a checklist in our head. Like a patient that goes home with a myocardial infarction, you want to make sure they go home on aspirin, nitro, statin, beta blockers, and calcium channel blockers if they need it. But the nice thing about PINNACLE, the checklist is there. Everything is transferred to referring physicians and specialists automatically. You'll come here on the 19th.
Because it's easy and intuitive, PINNACLE has evolved into a measurement and quality feedback system, helping busy practitioners excel.
We think that measurement of what we do is the basic way to improve quality. What we like about participation in PINNACLE, it tells us how we're doing complying with guidelines. We look at it as how high can we go?
The rationale behind adopting PINNACLE for cardiologists is twofold. One is their commitment to excellence and quality, and number two, improving methods of demonstrating at the point of care the quality that they perform for that patient and also the health plan. So there's a financial incentive.
As reimbursement moves away from fee-for-service and toward quality-based compensation, the strategy at Fort Wayne Cardiology is to be prepared for both clinical and financial success.
We want to skate to where the puck is going to be. So from a cardiology community standpoint, we want to be at that future state before that future state fully exists.
This gives us the perfect opportunity to really put into place the redesign of our workflow, the redesign of our IT systems, that when we do have some tie to reimbursement through payment reform, we'll be ready.
The modern cardiology practice can play a critical role in advancing medical knowledge.
The PINNACLE Registry will allow data mining with de-identified data. This will provide just a robust source of information to the practicing cardiologists on the real-world outcomes.
I'm ready for my PINNACLE lesson. Take me through this. Adapting to a new system can be challenging, but the doctors and nurses we talk to say it's well worth the effort.
We've eliminated the nuisance factor with this because the way we submit data now electronically takes 5 to 10 seconds.
If I were doing this day one, I would find tools that would facilitate my accurate reporting of the quality that I and my partners do. We just happen to find PINNACLE to be that vehicle for us.
Throughout our visit to Fort Wayne Cardiology, I was impressed with the entire team's commitment to delivering high-quality care to every patient, every visit. PINNACLE coordinates different roles around a common script. And there was that intangible but most important factor, professional pride, the satisfaction that comes with helping patients live longer and healthier lives.